That breath you keep masking with mints, it might not be a hygiene problem. It might be something your body has been trying to warn you about for a very long time. And here's what makes this important. Researchers have now identified a specific connection between the bacteria living inside chronically inflamed gums and the inflammation found deep inside the arteries of the heart. Not just any inflammation, the exact kind that builds silently. Before a cardiac event, if your breath carries a persistent metallic quality or a sulfur smell, one that keeps coming back no matter how many times you brush, stay with me, because what I'm about to share changes how you think about something you may have been ignoring for years, not to frighten you, to give you information most people never receive until it's much harder to act on. So, before we go any further, a quick note. Everything I share here is for general education only. It is not a diagnosis. It is not a substitute for care from your physician or dentist. If anything I say today feels relevant to your situation, the right next step is a real conversation with your doctor. Now, if this kind of clear, evidence-based health information is valuable to you, consider subscribing. We're working toward 2,000 new members of this community this month. And before we get into this, drop your age in the comments below. I read every single one. It helps me understand who's watching and what I should be covering next. All right, so let me ask you something. When you think about your heart health, what comes to mind? Blood pressure, maybe? Cholesterol? Exercise? Weight? I'd be willing to bet your mouth never made that list. And that's exactly the problem. Because what researchers have discovered over the last 2 decades is that the mouth and the heart are communicating in ways we are only now beginning to fully understand. And there is one specific signal most people are receiving right now and completely ignoring. But to understand why that signal matters, you first need to understand something that most people get completely wrong about bad breath. Most people think bad breath is a surface problem, something you fix with a mint or a rinse or a better toothbrush. And sometimes that's true. Coffee breath, morning breath, something you ate. These are temporary, but there's another kind of bad breath, a kind that keeps coming back, a kind with a specific smell, sulfur, metallic, rotten, and that kind is not a hygiene problem. That is a biological signal. Those smells are produced by specific bacteria that thrive in the deep pockets around inflamed gums, bacteria that release compounds called volatile sulfur compounds. And here's the part that changes everything. These are not bacteria that simply stay in your mouth. For years, the medical world treated gum disease as a local condition, something confined to the tissue around your teeth, managed there, treated there, stayed there. But newer research, including data reviewed by the American Heart Association, began pointing towards something far more complex. The mouth is not sealed off from the rest of your body, it's a gateway. And when gums become chronically inflamed, something happens to the tissue lining the mouth that most people never think about. The tiny microscopic tears begin to form. Think of your gum tissue like a screen door. When it's healthy and intact, it blocks almost everything. But when it's been inflamed for months or years, that screen door develops small tears in the mesh. And through those tears, bacteria enter the bloodstream. Now, here's where this gets even more significant. Certain bacterial strains strongly associated with advanced gum disease have now been found not just circulating in the blood, but physically detected inside arterial plaque, the same plaque that builds up inside the walls of your arteries, the same plaque that narrows blood flow to your heart. Let me be very precise here, because accuracy matters to me. This does not mean bad breath causes heart attacks. Anyone who tells you that is oversimplifying the science in a way that doesn't serve you. But what the research does suggest is something worth understanding carefully. Chronic gum inflammation and cardiovascular inflammation appear to travel together. They share common biological pathways. They may share a common driver, and your breath, that persistent metallic or sulfur smell, may be one of the earliest visible signs that this inflammation is already active somewhere in your body. So if it's not a direct cause, then what is actually happening inside? That's the part that took researchers years to work out. And it comes down to one of the most important biological systems in your body, your immune system. When bacteria enter the bloodstream where they don't belong, your immune system responds. It doesn't know exactly where the threat is coming from. It just knows something is wrong, so it activates. And when it activates, it releases a cascade of inflammatory signals that spread throughout the body. Researchers have a way of measuring how active this response is. It's It's called C-reactive protein, CRP. Think of CRP like a smoke detector installed in every room of your house at once. It doesn't tell you which room is on fire, but it just tells you that somewhere something is burning. Research reviewed by both the CDC and the American Heart Association has established that elevated CRP levels are associated with significantly higher cardiovascular risk. And here's what's critical. People with chronic periodontal disease frequently show elevated CRP, not because of one isolated incident, because their immune system has been partially activated for months or years. And what happens to blood vessels when low-grade inflammation runs quietly in the background for that long? Arteries begin to lose flexibility, they stiffen, plaque builds more readily along vessel walls. The blood itself becomes slightly more prone to clotting. None of this announces itself. There is no alarm, no obvious symptom you can point to, and it just happens slowly, quietly, for years, which is exactly why I want to tell you there wasn't. And that is the entire point. Most of this never becomes dramatic if you catch it early enough. But here's the question you need to sit with. What happens when no one catches it? What happens when the quiet signals are masked with mints for another 5 years? Research tracking people over long periods of time has found that individuals with untreated chronic periodontal disease face meaningfully higher rates of cardiovascular events compared to those with healthy gums. Not a small difference. A consistent, measurable pattern found across multiple research populations. So again, association, not proven direct causation. I want to be honest with you about what the science says, but here is what I know from over a decade of practice. When two systems in your body are this closely connected, ignoring the signal in one means you are almost certainly missing information about the other, and you deserve that information. So let me give you something practical. How do you tell the difference between ordinary morning breath and a signal worth paying attention to? A few patterns that matter. Temporary bad breath clears up. After brushing, after rinsing, after eating, it responds to hygiene. It doesn't come back with a specific smell. Regardless of what you do, chronic pathogenic breath is different. It carries a consistent sulfur or metallic quality. It returns within hours of brushing. It's often accompanied by gums that bleed easily, gums that look red or puffy, gums that have started to pull back from the teeth, or teeth that feel the slightest bit loose. If you've already been told by a dentist that you have gum disease and you also carry known cardiovascular risk factors, elevated blood pressure, elevated cholesterol, family history of heart disease, a smoking history, that combination is worth an honest conversation with both your dentist and your physician together, not in two separate silos, together. Now, let me give you something you can actually do, a straightforward approach that physicians and dentists are increasingly aligning on for people who want to protect both their oral health and their cardiovascular health. And at the same time, the first step is the one most people underestimate. Consistent, thorough oral hygiene. Every day, not when you remember. Every day, brushing twice daily, and critically, cleaning between the teeth daily. That is where the most damaging bacterial buildup actually lives, below the gum line, in the spaces a toothbrush cannot reach. The second step is regular professional dental care. Not just when something hurts. Gum disease progresses quietly for a very long time before it causes pain. Pain is a late signal. Professional exams catch the early one. The third step is the one most people have never been told. Stop treating your mouth and your heart as two separate conversations. If you see a cardiologist or a primary care physician and you have gum disease, mention it. If you see a dentist and we have cardiovascular risk factors, to mention those too. Your care team cannot see the full picture. If you give each provider only half of it, the fourth step is broader, but it supports everything else. Anti-inflammatory lifestyle habits affect both systems simultaneously. Consistent movement, a diet built around vegetables, fiber, and whole foods, quality sleep, not smoking. These aren't just hot recommendations. They aren't just dental recommendations. They reduce systemic inflammation everywhere, and that matters for every organ in your body. I'm not going to recommend a specific product or a supplement or a test you have to buy. What actually changes outcomes is consistency in the basics combined with real open conversations. With the professionals managing your care, here's what I want you to carry with you. From everything we've covered today, your body does not announce danger loudly, and it whispers first. The persistent bad breath you've been covering with a mince for the last several years, it isn't an embarrassment, it's a message. and you just learned how to read it, you're not sitting here waiting for a crisis. You're watching this video, you're paying attention, you're asking questions most people never think to ask. That is not a frightening place to be. That is the exact right place to be. The people who protect their health long term are not the ones who waited for a dramatic sign. They're the ones who listen to the quiet ones, just like you're doing right now. If this gave you a clearer picture of your body and what it may be trying to tell you, that is exactly why I make these videos. Subscribe so you don't miss what's coming next. Leave a like if this was worth your time, and tell me in the comments, has a doctor or dentist ever mentioned this connection to you before? So I read every comment, every one, and I will see you in the next one.